One of the things that's really important is that men don't like going to the doctor. You know, they have an aversion. And that aversion goes back culturally for decades, right? We're grown up to be, men, you don't be sick, you're a man, And so that we carry that into adulthood, that we can't be sick. That has caused us to have more problems, has caused us to die prematurely. And so there's this 5-year gap between men and women, that 5 years gets more important as you get older, right? It's that men aren't living as long, and it's because of a lot of these things that we grew up. We're risk takers. Boys have the highest infant mortality rate, and then by the time you're 100, there's 8 times more women than there are men, and so we're at a disadvantage our entire lives. We have a way higher risk of dying at work. So occupational hazards, way more than women in terms of, just no matter what the profession is. And so what we're going to do at the Cutler Center for Men is really look at how can we address those problems where they are. Having a primary care doctor is critical to extending people's lives, right? So I always tell people, you want a primary. I have patients that will go to the urgent care. If I get sick, I'll go to urgent care. I'll go to the ER. That's a terrible place to get medical care. They're there to address the urgent or emergent problem that you have, right, at that point. They're not there to prevent anything. And so we're going to be proactive and say, let's go to the primary care doctor. They're going to try to find out, what are you at risk for? What are your risk factors, and what runs in your family? And so when you have someone who knows you and knows your preferences, I have patients that don't like doctors, so I have to try to make it as really more like a friend visit than a doctor visit, because they just don't like the establishment. They get nervous just from that matter. But once you have a primary care doctor that knows what you look like, you can address their care according to that, and that's something that you can't get in urgent care or in the ER. This is really to have someone that knows you. Like most of the men that show up to see me, they usually were sent by their women. They've been sent by their wives, or sent by their daughters, or sent by their mothers, the younger men. And so women do make the majority of the health decisions in a men's life, whether you're a boy or a young man or an older man. That's just the reality of it. And so we're really trying to lean into that and give women a resource of something so that when you refer them to the Cutler Center for Men, we're gonna take care of them in a way that's in line with them not wanting to avoid future interactions with us, right? Because we know they make those decisions, but we also want to empower men to be able to say, it's not. I'll go to the doctor. It's okay. I can go there and visit. I don't need you to come this time. And so we have this Joe team that will help facilitate that, help you make the appointments, help you follow up with the appointments, help you get an exam or a study that's been prescribed. Our Joe team can help do that, so that we really want to take some of that pressure off of the women in your lives and put it on us. And so that generous donation from the Cutlers, we're able to have, regardless of what your insurance is, and that Joe team help support you and guide you and help you navigate this sometimes difficult situation.